well as the co-lead for the pandemic unwinding side of things. I'm gonna get my screen share going here. Alrighty, hope everyone can see my slides. We've got a ton of content to go through today, so we're gonna keep moving quickly through it. So welcome to the Oregon Health Update Office Hours series. We're going to keep doing these as a topical series on whatever's relevant at the moment. Right now, OHP Bridge and redeterminations are really the top of the docket, but we'll have other topics coming through here. For instance, waiver of housing benefits launch in November. So we'd love to keep sharing relevant topics to you through this meeting series as we have those come up. So our agenda today is going to start off with the OHP Bridge, or the pandemic unwinding updates, and then go into the upcoming changes, followed by the OHP Bridge updates. On the renewal side, we are heading into the July wave of renewals. So we've got the 4 waves of renewals here on screen that are happening over the summer. We sent off the June batch last month. Those are currently active for folks right now, and you're helping people through those June renewal batches. And then later this week or next week, the July batch will start off. So as with any time previously during the pandemic, people have at least 90 days to respond. So somebody who got their renewal letter in June has until the end of September to respond. If they don't respond by then, they would get a termination notice telling them their benefits are ending at the end of November. They've got that 60-day window there. And then up to 90 days after getting closed for not responding to an application, you can still get your case reopened without a new application if you get in touch with us. So they've got until February 2025 even to get that information to us for the June wave. Then we have those additional waves. The final one will be sent to members in September, and then resolve, like the terminations would happen in February 2025. So that's our new end date for unwinding. Out of the renewals we've completed so far, which is 91.8% of the total we expect to go through, 82.6% of people are continuing benefits, which is great to see. About 0.8% of people have had a benefit reduction. Usually that's going from OHP to a Medicare savings program or a dental-only benefit. And then for 16.6% of people, their benefits have ended and they're needing to find other coverage, such as the marketplace, employer coverage, whatever they have available to them. When we compare that to other states, this actually looks really positive for us. In our previous press releases and presentations to date, we've been using KFF, which is a National Health Policy Institute, for their tracking comparison. We were also made aware in last month of a Georgetown University study, which actually shows us in first place for the highest renewal rate in both of their categories. So we're quite potentially the highest renewal rate in the country, which is something that y'all's work has done a major part in getting us to. So we're really glad to see most people are keeping benefits, unlike many states where more than half of people are losing them. So stark difference in the experience between states. All the steps Oregon has taken, like OHP Bridge and whatnot, have really made a contribution to getting more people staying covered. So we're really glad to see that comparison there. For the remaining renewals, there are 3 major groups in those. There's people who are on the Oregon Supplemental Income Program, which is a program that specifically provides OHP to people who are legally blind, have a disability, and/or are 65 or older. And they're also going to need to have limited income and financial resources on that program. There's another group as well that are people who are part of a household that hadn't responded to renewals, then had their benefits restored or the renewals rescheduled in order to give us more time to update the renewal system. We did that in May in response to a federal request to update the renewal process on an individual versus household level. I'll get more into that in a bit. And then the other portion of the summer renewal group is going to be the people who are other household members of the cases with one of the 2 above. Because of that OSIPM population, we really see that the renewals happening this summer are going to be much more likely to be over 65 or have a disability. The total population of about 120,000 that is going through renewals over the summer would have been a single month for us previously on the unwinding. We're intentionally spreading that across 4 months in order to allow for additional support for this population from the various workers involved, partners like yourself and whatnot like that. So one thing we do anticipate is that since some members in this group have previously closed or reduced and then were restored, if their income and resources have not changed since then, we would anticipate the same outcome. So we might see a higher closure rate than we had previously in the pandemic unwinding. One thing we really wanted to prepare for y'all to help prepare for this need with the heavy OSIPM population and whatnot is a helping non-match clients at renewal guide, specifically trying to help partners assist with financial resource questions and there's also going to be more extensive non-Magi training for partners coming up in the fall. So we're trying to prepare partners. We understand that since integrated eligibility only happened in 2020 when we got access to the non-Magi, the non-income-based programs. So any of the programs that are blindness, disability, or over 65 or age-based. Since community partners only got access to those programs in 2020, the institutional knowledge there has been slower to build up, and we really wanted to boost that support. So we've got a few slides here of content that'll be coming out in a guide that it's in translation right now, but it'll be coming out sometime this month on how to answer these sorts of questions. We've got a preview of the content coming up in the next couple slides. So when you get questions about financial resources, the real main guidance we want you to have is members who are over resource limits should always speak to an eligibility worker before making any financial decisions. People who have OSIPM or LTSS who have higher income or resources when they renew may be at risk of losing their benefits. However, they may have options for redistributing those finances in order to remain eligible. We really want them to be so we want them to know about that option, but also be very careful not to go off and do that on their own. Please be careful and seek advice because some transfers of assets can disqualify them from benefits going forward for a period of time. So it's really important to go talk to the eligibility worker, but we wanted to get the information out to you all so that way you can tell them enough, like there are some options potentially to stay eligible, go talk to the eligibility worker. We also do not want people to go without benefits that they're eligible for instance, by not taking options they would have wanted to take. We also don't want people to accidentally disqualify themselves going forward or mistakenly take like financial moves that could harm them going forward. For instance, mistakenly selling a house thinking that was the rule or something like that. We really want to avoid all those things. We understand this is not like the partner area of expertise. Eligibility workers are the main area for this, but you all have a role in getting people to them and knowing enough about the system to get people to actually take that action of connecting with the eligibility worker, whether that's through you connecting them to the CP focus line or them doing so on their own. There are a lot of limitations on our role here as well. You cannot give legal advice, that's only lawyers, or financial advice like a financial advisor would. We want you to be particularly careful about this because eligibility workers can tell members about their options to keep benefits and whatnot, explain all the different options. In some situations, they may need to get additional help from a lawyer specializing in Medicaid planning or get help from a financial advisor. So really the first step should be going to that eligibility worker, connect them to eligibility worker first. If they still have, if they express that didn't get their questions answered and they need further help, you could refer them up to a lawyer or financial planner through a service such as 2-in-1, legal aid, things like that. But you cannot give legal advice on whether a specific asset transfer is allowable. We really want you to direct that up to the eligibility workers. The other thing is just members need to make their own financial decisions. We're not financial advisors that should be telling them what to do with their money. That's for them to decide, and we want to respect that as well. So what partners can do to help in these situations is that you can tell members that they may have options to spend their savings in order to be eligible, and that it is important to speak to an eligibility worker first in order to learn how to do so properly to prevent future disqualification. Talk to the eligibility worker. After that step, if they've already talked with one, if it makes sense to refer them up to legal or financial advice through 2-in-1, legal aid, or aiding and disability resource connection, that is another way you could provide assistance for members who need to go beyond that step. You can also, as usual, help them respond to the renewals and update the available financial resources that are showing in their one account. That's going to be a major thing for a lot of these people. You can also help members who disagree with any outcome decision request a hearing, or when requested, help them schedule their interviews or connect them to the CP focus team to complete the interview on demand. You can also help members return asset verification forms when we request them. Those are all going to be things that we're going to see a little bit more common in this group. We saw a lot more of those in the June renewal waves in terms of requests for interviews and whatnot as well. So these are very complicated subjects. We just wanted to make sure you had some information on how to handle these questions. There's a whole guide coming out for this, and then a non-Magi training coming in September. But we really want to get the tools out to you as soon as possible to make sure you're able to support these renewals when you get questions in the meantime and know where to direct those up to the eligibility work staff. Other big change that happened recently, which you would have first seen in the renewals that came in June, were all the system changes we made in May. We talked about this back in May, but we got a request to revisit this content so more people could hear about this and dig into some questions more after having some time with the system and as it now works. So there were three big categories of changes we made to the renewal process in May. A lot of these were in response to the federal government request to update how we looked at passive renewals. But we also did some changes to the renewal process itself. For instance, we don't allow terminations without someone getting the opportunity to respond. For instance, if they're over income, they're going to be asked to confirm their income before we take action based on that. Then we also made some notice improvements to the notice design itself, like the notices you read and whatnot, and we'll get into some examples of each of those in the next slides. So the big change I guess the federal government request that provoked this whole delay of renewals in general was they found an issue in 30 state systems where previously, when the system attempted to passively renew somebody through the automated process, if one household of the member of the household couldn't renew automatically, the whole household would get the renewal packet. And then if they didn't respond to that renewal packet, the whole household would close. CMS needed us to fix it so the passive renewal process could be run on an individual level. So now that, for instance, a child in the household can keep benefits through the automated renewal process, but if their parent needs to respond, only the parent will get the pen for income, and the child's not at risk of closing if the parent doesn't respond. So big change there. It'll help more people keep coverage through that automated renewal process. And then in the notices themselves, you'll see they look quite a bit different now. One major change that you'll see is that we now have a page one summary up front where we've got a color-coded action box in the top right, as well as color-coded boxes for each individual on which action that member needs to take. Or it says they're good to go if they're green, like the one we got on the right there. Other change we made to these notices was really moving some of the focus in them away from the specific program. For instance, Magi Adults is the main program for OHP adults. Moving the focus towards the benefit level, like OHP Plus. There are now example notices up there on the screen, but one other big thing that that focus on the benefit level instead enables us to do is to explain moves within the benefit category if you're moving between programs. For instance, the examples I've got on the right side here are for a child who just turned 1 year old. So previously, if you look at the bottom right, there's the two programs at the very bottom. It says this person was on Magi Child under age 1 previously, and then they moved to Magi Child age 1 through 18. Previously, we would give them a termination notice for the old program and then tell them their benefits started on the new program. Now we have the functionality in that text you see at the top right of the page where it can say that this person has moved to a different program because something changed, but their benefits have remained the same. So hopefully that'll be reassuring for these members when they get these sorts of letters that nothing has really changed. We needed to tell them because it's a program change technically, but the benefits they're going to experience are going to remain the same. So hopefully that'll be less panic-inducing for members when they get things like that say they were terminated or whatnot, but benefits are still continuing. There were also just a bunch of other changes to the renewal process. We've now got a single renewal packet or renewal notice that replaces the old renewal packet and fixes the situation where renewals could arrive in two separate letters, one saying that they were passively renewed and needed to respond, the other specifying what they needed to respond with. That's going to be significantly alleviated by those changes there. We've also reduced and clarified the remaining situations where that passive renewal with request for information occurs. It will still happen for immigration and citizenship pens, but the notices in that situation will be much clearer on what's required of the member. So we've significantly cut that confusion, and then for the remaining situations, it's going to look a lot better too. And then I mentioned the other change where if you're over income, for instance, you're now going to get a window to respond rather than immediately proceeding to termination, which will get more letters, more opportunity to respond, and hopefully ease people's path to the marketplace or whatnot if they're ineligible. Okay, that's it for the unwinding section. We'll be taking questions at the end, I believe. I'm going to move on to a couple other updates on non-unwinding topics that we wanted to share as well. First off, you may have heard in the news that there's a federal policy change about the Deferred Action for Childhood Arrivals program, otherwise known as DACA, where they're going to be eligible for the health insurance marketplace for the first time starting in November. They will also qualify for financial assistance, which they are previously excluded from. That's about 10,000 people in Oregon, so actually a pretty substantive change here. This will apply to OHP Bridge as well in the future, though we are currently not certain when this will take effect for OHP Bridge. We are not confirming the November date at this time. We're trying to make sure that we are 100% certain that we can implement that on time before we promise it to anyone, though we are committed to doing so on November 1st, if at all possible. We are confirming that whether or not it's possible within the system, if that makes sense. So exciting change there. Other update you may have seen in the news this week was we just had an announcement of the approval of the carceral waiver. The waiver is the process where we request the permission from the federal government to make changes to OHP. One of the big things that many people were excited about there is the change that will allow people to offer benefits or offer OHP benefits to people transitioning out of incarceration in the 90 days prior to release. That timeline, we're currently building out the implementation for that as well, but it's sounding like it's likely to be 2026 when it's available to members. And you can read more in the press release about that this week if you'd like. Alrighty, that's it for my topics. I believe I'm handing over to Katie Waldo with the OHP Bridge team now to talk about OHP Bridge.
Awesome. Thank you, Sean. So as Sean mentioned, my name is Katie Waldo. I am the lead project manager for OHP Bridge. So I'm here to give you a broad overview of the program again, and then answer some questions from this month that we received through our email. Go to the next slide. So for those of you that are just hearing about OHP Bridge now, or who have heard the name but don't know much about it, this is a new benefit for adults with higher incomes. And in order to be eligible for this benefit, you have to have an income between 138 and 200% of the federal poverty level between the ages of 19 and 64. And we'll talk about that a little bit more in the future. You cannot have access to another form of affordable health insurance. So this is something that's a bit different between OHP Bridge and traditional OHP. And we'll also get to that in a few slides. And have an eligible citizenship or immigration status. The benefits on OHP Bridge are going to be very similar to those on OHP Plus. And the main key difference is that those on OHP Bridge will not be eligible for LTSS or HRSN at this time. It is a free benefit, so there's no member costs, including copays or deductibles. Zoom on to next. To further explain a bit, so we have two OHP Bridge programs, largely with the same benefit here in Oregon. So the first is our OHP Bridge Basic Health Program. This is exclusively managed by CCOs, so there's no fee-for-service or open card option. And this is where the majority of our OHP Bridge members will receive their coverage. We also have OHP Bridge Basic Medicaid, which is for our American Indian and Alaskan Native members. And this was created in order to preserve the right of those individuals to choice between CCO coverage and open card. So we have some very exciting news about OHP Bridge, and that is that it successfully launched on July 1st. So this benefit is now available to people in Oregon. We have roughly 25,700 people that we're tracking so far associated with this program. The bulk of those individuals, about 22,700 people, have successfully moved onto OHP Bridge effective July 1. About 1,600 people remain on our temporary Medicaid expansion, which is the program we set up post the end of the public health emergency in order to keep people that we thought would likely be eligible for OHP Bridge covered until we launched the program in this month. So those are individuals, the 1,600 still remaining on that program are individuals that we think may be eligible, but we've identified that there's a little bit more information we need from them before we make a final eligibility decision. About 1,300 people were redetermined onto other medical eligibility programs, such as Medicaid, and about 3 were closed due to valid reasons, such as no longer being part of a household or terminating their coverage on their own. Just really quick, reminding everybody what it's going to look like for enrollment over the next couple of years. So a group of people moving from OHP, so people, as I mentioned, that were on the temporary Medicaid expansion are the first to move. They have automatically moved onto the program on July 1st, so they are now covered through this. We expect some people to start coming in from the uninsured population as of July 1st as well. So that application is open, and we assume we'll start to see people coming in from that group. The group that will move over the most gradually will be those moving from the marketplace. So people that are currently covered through marketplace coverage that fall between 138 and 200% of the federal poverty level will gradually move on to OHP Bridge over the course of the next 3 years. And that's because people who are receiving coverage through the marketplace will not automatically be moved by the system. So if they have things, if they've selected auto enrollment, re-enrollment, and if they don't have any household changes that they need to declare, such as moving or a change in income status or citizenship, things like that, then they will stay on their coverage through their auto enrollment period. So We expect to see them slowly move on over the next 3 years. So just wanted to show that. Okay, next up, we wanted to make you all aware of some partner training and resources that we have for you all. We know that it's very exciting to have a new set of programs launched and that it can be a little bit overwhelming and confusing. So we wanted to make sure there were as many resources for you as possible. The first is our OHP Bridge partner training, which was made available as of May 15th via Trackstar. We have it available both in English and Spanish, and you can access those on the links that are on the screen and that will go out to you all following this meeting. We were encouraging people to take it before July, but it will still be very valuable if you haven't taken it yet, to go ahead and take a look at that. It's roughly an hour long, and it's got some great information for you all. So we definitely recommend you take a look at that if you have not already. We also have some written resources for you all via our website, which again, we have in English and Spanish, and you can access at the URL on the screen. This includes our FAQ and a outreach toolkit. There are some other materials that will be coming as well. We've got a video on the website. There's some great resources there. So we highly recommend you all kind of keep a track of the website. It will continue to be updated with more resources and options and information. Additionally, I wanted to add that the FAQ is a living document. We continue to add questions and answers to it. We'll be pulling a lot of things from our office hours and the questions submitted through our email. And so continue to reference back from that. We're really going to be working very hard to make sure that it stays up to date and continues to expand with information we hope will be useful to everyone. We also wanted to highlight that there will be an updated CPOP income guideline available on the form server and group site. So keep an eye on that. Lastly, we did want to flag for you all just a potential item that maybe people hadn't been tracking, which was that due to the fact that the federal regulations around basic health programs does not allow for a fee-for-service coverage option, there could be a little bit of a gap for individuals who are on OHP Bridge who move from one CCO service area to another. We want to flag this should not be a significant issue or frequent issue for people on OHP Bridge Basic Medicaid because they can access that fee-for-service coverage. However, for a majority of our members who will be on OHP Bridge Basic Health Program, if they move from one CCO coverage area to another, they may experience a slight gap in the time it takes to reassign them to the CCO in their coverage area. So there's going to be a guide sent out through the CP update newsletter on Thursday. But if we can hop to the next slide, we'll tell you what we're recommending for now. So for now, what we're suggesting everybody encourage people to do is that in order to reduce the fee-for-service gap in coverage for OHP Bridge Basic Health Program individuals, that if they are moving, they enter the address change in one online via the report change in how we contact you button, and then immediately email the OHP Client Services Unit at the email on the screen to request a faster re-enrollment into their new CCO due to the fact that they're on the basic health program. So we just wanted to flag that all for you all as soon as possible, since we know this could potentially be an issue for people. Okay, now we're going to dive into our question and response section from our inquiries response team. So we can go to the next slide and I'll just run through this. So as a reminder to those of you who are new, we are trying to establish an efficient, streamlined response process for your questions regarding OHP Bridge. So what we've decided is that we've kind of opened a couple of avenues and then we'll be answering questions here every month. So in order to submit a question to the OHP Bridge team, you have 3 different options. You can submit them through your CPOP Regional Outreach Coordinators, or ROCs, and they will funnel the questions to us. Or you can send them in writing via the OHP Bridge email, which is on the screen, or you can attend our office hours and send the questions through the registration form or live while we're presenting. We will then compile the answers that come from the ROCs and the email prior to the office hours, and we will answer them all and we'll be putting them up on the screen. You'll see that here in a moment. And you have up to a week prior to the office hours to submit your questions in writing that way. If you submit a question within a week prior to office hours, we will be bumping it to the next month just because we have to have enough time to ask the appropriate people to weigh in on the answer. And we're doing this this way because we have a fairly small team and we really want to make sure that we're able to give you all in-depth answers, but we just don't have the capacity to respond to individual emails. It's also because we realize that if one of you has a question, several others probably do as well, and we wanted to make sure that everybody has access to that information. So we will be providing the written responses back to those who provide questions via the email or the ROC following the office hours presentation. Okay, so with that in mind, diving into the questions. So our first one is actually an update from last month's office hours. We had someone ask a question regarding an individual who's on OHP Bridge and who turns 65 while they're covered by the benefit, and whether or not they would be kicked off when they turn 65. Last week, we provided an answer to this, but we've had some internal conversations since, and we realized some additional context would be helpful. So in response to this question, the updated answer is that for most members, yes. So if you are on OHP Bridge Basic Health Program member, your OHP Bridge coverage would close at the end of the month of your 65th birthday. However, if you are on OHP Bridge Basic Medicaid and you turn 65 but do not enroll in Medicare, you would keep your coverage until the end of your continuous eligibility period. However, if during that time prior to the end of your continuous eligibility period, if you enrolled in Medicare, your coverage would then be closed. We do want to remind you though that you would be evaluated for other coverage programs that you might be eligible for before closing your benefits. So just wanted to provide a little bit of extra context there. Along with that, we also had another question about Medicare relating to if you were eligible or have Medicare and you are between the ages of 19 and 64, would you be eligible for OHP Bridge, assuming you meet all the other criteria? And the answer is no. This is, again, an area where OHP Bridge is a little bit different than traditional OHP. You cannot have access to other forms of affordable health coverage, such as Medicare, and be considered eligible for OHP Bridge. So unlike traditional OHP, there is no dual eligibility option. Okay, so we had another thing we wanted to follow up on. We had some questions about this last month, and we just wanted to follow up again and reaffirm some things. So the first was that we had a question about why the number on the notices that went out in June to members regarding eligibility in OHP Bridge had the PH Tech number listed, and then we had a flag that there was some issues with that number. So we just wanted to clarify that the number on the notice is directed to PH Tech support staff because they're part of our community customer service center response team. So they are the ones that will be helping to field questions related to this program. We also wanted to flag that we were made aware of the phone line issue, and it has been resolved as of the end of the month. And so those phones should be up and running, and people should be, the customer service team should be ready to answer questions. So we apologize for any confusion that caused, and we really appreciate people flagging that for us so we could respond to it really quickly. Okay, so we had a question relating to opting out of OHP Bridge. So we had an agent reach out asking questions about people who may qualify for OHP but who do not want to enroll, in part because they have critical medical providers who do not accept OHP, or because their taxable income is low, but they're willing and able to pay for health insurance. And they were asking if there was going to be an option to opt out of OHP Bridge. And the answer there is that there is not an opt-out option for OHP Bridge. If you are eligible or you apply for a program and you are deemed eligible for OHP Bridge, you will not be able to get marketplace coverage and financial assistance on the marketplace. So that won't be an option for this program. Okay, we had another one regarding communications to marketplace clients. So we had some a community partner reach out mentioning that they hadn't seen anything in the news regarding OHP Bridge and that none of their clients had received information, and they weren't sure who was on point for sending out info and instructions to marketplace clients who might be eligible. So the answer to that is that healthcare.gov and the Oregon Health Insurance Marketplace are not able to identify marketplace enrollees who may qualify for OHP Bridge. And as we mentioned earlier, also marketplace enrollees will not be automatically moved to OHP Bridge. And so they will learn about the program when they update their application and are sort of reevaluated for eligibility. And that's when they'll receive information about this program and will be made aware that they are eligible for it. In addition to that, partners who are working with marketplace clients or who are working with any individual who may be eligible for this program can find more resources at the website, as we mentioned earlier, all the ones including our FAQ, outreach kits, and trainings. and that should help support community partners who are guiding potential members through the application process. We had a question regarding OHP access specialists and OHP Bridge. So asking whether or not access specialists will be helping people get onto the new program. And the answer is yes. Certified OHP community partners can help people apply for OHP Bridge, and the application for this benefit will be the same route as traditional OHP. Question about CCO options. So whether or not they would be the same as they are for OHP, traditional OHP, and whether people will have a choice between the options. So the answer is yes, the same CCOs that are administering traditional OHP will be administering OHP Bridge, and they will have the same service areas. And in a similar vein, just like with OHP, a traditional OHP, if a member is in an area that's served by multiple CCOs, they will have the same chance to choose as they do with OHP Plus. However, if you are in an area that is only served by one, obviously then we unfortunately can't give you option. You'll just be enrolled into the one that's serving your area. Okay, we had some providers and clinics reach out regarding any prep that they might need to do for OHP and whether they need to do anything on their end to be credentialed or contracted to see clients with this new plan. And the answer is no. If you are enrolled with your local CCO, you shouldn't need to do anything additional to see clients on OHP Bridge. And just as a quick reminder, OHP Bridge requires CCO enrollment for a vast majority of their members. That will be the OHP Bridge Basic Health Program option. It will only be American Indian and Alaskan Native members who have the option for open card and fee-for-service through basic Medicaid. Okay, I think I'm handing back to you, Sean.
Sounds good. We also get a lot of questions this month about how OHP Bridge determines income. For instance, this one's asking about there's a difference or the question's asking about with difference between marketplace and OHP household income determinations, about the standards we use. They give the example of a pastoral housing allowance and whether or not that counts. And basically, what standards are we using for OHP Bridge? So OHP Bridge is going to use modified adjusted gross income standards. That's the same basic standard that the marketplace uses, as well as many OHP programs. Basically, there are two types of OHP programs. There's the ones that are based on modified adjusted gross income, which we call MAGI programs. And then there's the ones that are based on being over 65, disability, or blindness, which are the non-MAGI programs, which there's a difference for pastoral income specifically on whether or not it's counted on those two fronts. OHP Bridge is going to be one of the MAGI programs and going to use those standards. You can learn more about those income standards if you're not already familiar at the links below at the bottom. We also got a question about marketplace renewals and OHP Bridge. Basically, the toolkit says that the people will be able to keep their tax credits until their automatic re-enrollment period ends, unless there's a change to their application sooner. And it's not going to cancel on their own after they get approved for OHP Bridge. If clients renew during open enrollment, their marketplace plan auto renews right at the end of December. If they're deemed eligible for OHP Bridge and the tax credits, their premium for the month of January will draft by the 5th of January. If they don't cancel their marketplace plan, they could end up with a full premium pulled from their account in January. As agents, we don't have a way to sort clients by income, and they wanted to know how best they can assure clients can make sure that they're not affected by this and having to pay premiums for coverage that they aren't using or eligible for. So the answer on this one is that marketplace enrollees who have given healthcare.gov permission to access their IRS returns, there's a question on the application that asks that, they will be automatically re-enrolled in the financial assistance, so they wouldn't have to pay the full bill portion of that. So they would get automatically re-enrolled into their current plan with the financial assistance. If they didn't click that permission in the application, then they would be automatically re-enrolled without the financial assistance, which would create that situation the questioner was asking about, where they might have to pay the full bill. Anytime someone actively updates their marketplace application, it's going to be sent over to OHP Bridge for a determination. If they're determined eligible at that point, for instance, during open enrollment, we would give them coverage based on the start date rules that OHP Bridge has. So we're not a little certain that the coverage would actually start on January 1st based on that. It really depends when on the month they updated it. Once an individual is confirmed eligible for OHP or OHP Bridge by the state, though, they really must return to the marketplace to update their application and tell them to end marketplace coverage, including their eligibility for tax credits going forward. So the marketplace sends a notice prior to open enrollment each year that confirms enrollment in the next plan or for the next plan year. Um, Whenever eligibility is reassessed during that process, the eligibility notice will be produced, which tells the individual their next steps. All the correspondence is going to be visible in their healthcare.gov account. So connecting with the client in advance, monitoring their healthcare.gov account is really the best way to see what's coming up for that client and prevent them from any unnecessary bills, which requesting retroactive termination and whatnot is also possible if that's appropriate. So there's many situations there where there are ways to prevent that from occurring, but active monitoring as we head into open enrollment season is going to be helpful for these people. Other question on retroactive benefits. Basically, does OHP Bridge allow for retroactive coverage? In most cases, no. There is no retroactive coverage option for OHP Bridge Basic Health Program specifically. This always has a future effective date. It follows the same rules as the marketplace, where if you are determined eligible by the 15th of the month, you get coverage on the 1st of the next month. If it's after the 16th, there would be a month of gap. So it would be the following month after that. So currently September. For OHP Bridge Basic Medicaid, on the other hand, we do offer retroactive coverage following the same rules as OHP usually does. So OHP Bridge Basic Medicaid follows the normal OHP start date rules, where it goes back to the first of the month you apply in if you were eligible for that month. It will also offer the 3 months of retroactive coverage like we normally do. It will not go back past the July 1st start date of OHP Bridge, though. So basically, Basic Medicaid does offer the retroactive coverage, but not past program launch date. We also got a question about reporting changes to the marketplace. So the scenario that the questioner posed is a marketplace enrollee reports a life change on healthcare.gov, which then sends the application to OHP because the marketplace thinks they might be eligible for OHP. And they want to know about what happens after that. Will OHP enroll the individual if they get approved, and what the process looks like in the timeline? Would it be more efficient to send the individual to apply through Oregon.gov after the marketplace sends their application info to OHP? So when the marketplace sends an application to OHP, they get screened for assistance through the normal process. It gets entered in as an application on our side once we receive it from the marketplace. And if they're found eligible for OHP, we would assign them a start date of benefits based on when we make that decision. So I mentioned the 15th of the month rules on the last slide. It's going to be the same start dates based on when they get approved. We wouldn't advise submitting an application for OHP Bridge after your application already gets sent for OHP Bridge, since you're applying twice that way. But people who think they might qualify for OHP Bridge can apply for OHP as the starting move, rather than reporting the change to the marketplace immediately. If they are then eligible for OHP Bridge, though, they would need to tell the marketplace about the changes, that they have other coverage, and then close their marketplace application and withdraw their financial assistance. That might be a faster path for some members who are needing OHP Bridge quickly. Specifically, you're running up on one of those 15th of the month deadlines to get approved or something, though we wouldn't suggest submitting 2 applications if it's already been referred over to OHP Bridge, if that makes sense. They also got a question about the income verification and whether it's by month or by previous year's tax returns. This one came up quite a bit this month. Income verification is generally going to work very similarly to other OHP Bridge or other OHP programs. So when applying, the one system is going to request income proof if needed on most applications. OHP Bridge eligibility for most members is going to be based off their annual income. That's the basic health program members specifically. So the documents submitted should support the annual income reported on the application. So you can use either pay stubs or a tax return. So even if it's showing the current monthly income or something, you can use that as income proof, though a explanation of any differences between the current monthly income and the annual income can really help that be verified, acceptable as verification of the annual income. So we're trying to verify the annual income, though using whatever you have available within an explanatory note can help get that over the threshold for us. We also had a question about the notices. Specifically, this was an eligibility worker who came into an office asking why they weren't able to view the first transition notice people got for OHP Bridge in the one system, and asking if they were sent outside the one system, which the answer there is yes, they were sent out of the side of the one system. That was based on a data request. We needed to meet a 10-day advance notice requirement about the move to OHP Bridge, and the only way to do that was outside of the one system. The second notice they got when they actually moved, I believe it was the 27th of June, that notice should be visible in the one system for all members if you check their correspondence. And then coverage choice. Will Oregonians who make 138 to 200% of the poverty level but want to go through the marketplace rather than enroll in OHP Bridge lose their federal tax credit nonetheless? We answered a very similar question to this one earlier in the slides, but basically, yes, they would not be eligible for tax credits going forward now that OHP Bridge is launched. They can remain on their current plan with the financial assistance so long as they're not updating their application, though they're still required to report updates if their job changes or something like that. So if they've have no changes and have told the marketplace that they can use their IRS records to re-enroll them with financial assistance next year, then they would be able to keep that financial assistance going. If they haven't given that permission, then they would be automatically re-enrolled without the financial assistance, and any action to get that back would probably trigger them to get sent over to OHP Bridge for screening. And then another really common one this month was, is OHP Bridge based on 200% of the poverty level per year or monthly? For instance, somebody who earns under 200% monthly, but due to bonuses, they earn 200%, 5% or more per year. So this one also depends on the program. So we've got OHP Bridge Basic Health Program, which uses an annual income limit of 200% of the poverty level. So most members are going to be using annual income on this when they apply. OHP Bridge Basic Medicaid members, on the other hand, use a 205% of the poverty level monthly income limit. So it's both slightly higher than the 200% income level. There's a 5% what we call disregard on there that gets added on. And it uses monthly income like you're familiar with other OHP programs. So American Indian and Alaska Native applicants are going to get screened for both. So there is a situation where someone who has a high current monthly income, but a lower annual income could end up on OHP Bridge Basic Health Program, even though they're Native American. Though if their income drops later in the year, as it predictably should in that situation, they would move over to Basic Medicaid when their income drops. So the short answer is, in most cases, annual, though Basic Medicaid does use the monthly, and some situations you can be screened for both that way. Hopefully that clears things up for folks. And then another question was, what was the reasoning for not having copays or some sort of cost? This population already qualified for coverage with significant financial help through the marketplace, and we saw they were more likely to be uninsured and report delaying care due to cost. Since deductibles, copays, any of those out-of-pocket costs can be a barrier to people seeking care, specifically when they're right over that income range, it's particularly felt. We don't want those delays in care to result in their healthcare problems becoming more serious and expensive before being treated. So the lack of copays or member costs will hopefully get these people using more preventative care, primary care, treating problems early, and reducing the healthcare costs across the system. Alrighty, we got through our questions. It looks like we have a solid 10-minute chunk for audience questions this time. I'm glad we got through it on schedule. So I think we've got some people chiming in on the chat, so let's start taking a look.
Yeah, it looks like we have 3 questions in the chat. The first was answered by Maria in that thread. So let's get to the next one. Will bridge claims have risk withholding taken out at payment?
Katie, do we have a billing person on hand available to?
I am not sure. We can take that back though and ask our team and bring it to next month.
Bringing us some good questions, it sounds like.
And the next one is from Chris. What plans do the members get assigned to through Bridge?
That would be through their local CCO. So it's going to be the same options as the OHP CCOs in the area.
Those are the questions that we have in chat. If you have anything to follow up with or any last minute questions, please either post them in the Q&A function or in the chat. Give it a minute or two in case anything pops into people's minds.
I have a quick question. I was trying to type it in the chat, but it's not working for me. Is the affordability percentage set at the same level as the marketplace?
Yes.
So, okay, perfect. So that, what is it, 8.39 or something?
Yes, currently it updates every year, but that's for this year.
Perfect. And then if a spouse is offered health coverage, does it follow the same rules as the marketplace, basically? Okay,
Yes.
perfect. Thank you.
Hi, this is Laurel Swordlow. I support Katie and Sean in the OHP Bridge Program. And I'm wanting to make sure that I'm tracking the question that Tyla is asking in the chat. The question about whether or not bridge claims have risk withholding taken out at payment. Tyla, can you say a bit more about what you're asking?
Or put it in the chat for us.
I want to make sure that when we follow up, we're answering the right question. Okay, well, we'll hold on digging into that question until you're able to follow up with a bit more specifics, Tyla. So feel free to reach out to us just with more detail of what you're trying to ask there.
It looks
We
like
do have one
Tyla.
more.
Oh,
Sorry,
sorry.
go ahead, Katie.
It looks like Tyla maybe left the meeting, so
Got it.
I'm not sure, but yeah.
Looks like we do have one more question. If a member applies for Bridge today, an employer does offer coverage, but is not available to the member due to closed open enrollment. Is this an exception to the rule?
No, that is not. If someone's has a employer coverage but hasn't enrolled in it, that still counts as an offer of coverage through marketplace rules. So that's going to prevent them from being eligible.
Okay, and
If it's affordable and things like that.
For Bridge, does determined eligible mean that income was cleared or just their temporary eligibility?
I'm sorry, can you repeat that question?
For Bridge, does determined eligible mean that income was cleared or just their temporary eligibility? And that was by Susan, if you have any clarifying questions.
It sounds like that might be referring to like a temporary approval before the continuous eligibility is locked in, like while we're still requesting income proofs or something like that. Is that?
I'd love a bit more context of when this person is seeing that phrase.
So when they say if the person is determined eligible before this 15th or before, their coverage will start the following month.
Yes.
So
Okay.
we did an application on the 5th. It's still pending income, but his notice says he's starting on August 1st. His income have to be cleared before the 15th for coverage to start on August 1st.
Super appreciate the question. And I actually don't know that's the specifics of that answer. Tim or others? I think that is a super clear question that we can bring back to our eligibility analysts.
Yeah, I don't have anything else on that either, but I think we can get that.
Yeah.
I'm like 90% confident that they're going to be allowed to enroll, but that's the sort of level of confidence that we should definitely go back and check that before giving an official answer. So
It's like we have one more just submitted to the Q&A. Will eligibility verification be the same with Bridge as it is for the CCO?
Can you read that again? Will eligibility determination be the same for Bridge as it is for the CCO?
It is, will eligibility verification be the same with Bridge as it is for the CCO?
So OHP Bridge is predominantly administered through CCOs. So the CCO verification process would be the same. Is that what the question?
but eligibility is
Yeah.
usually on our side, at least.
Yeah,
that's
so
what-
my question was like calling from the doctor's office. So if we're verifying the patient's eligibility, like All Care, we can log into the All Care website, or we can you know, go through
Yes.
MMIS.
It's through the same, yes, it's the same.
Perfect, thank you.
And that looks like that is all of the questions that we have had come through.
Well, since we're running up at the end of time today and we're apparently without questions, I think that is the end of our time. We have our next meeting coming up the 13th, it looks like, and Spanish one next week on Wednesday.
Yes, and our original meeting series for office hours was due to conclude at this last meeting. I have added another occurrence on because we will be continuing next month. So the link to join will be the same, but if you'd like to re-download the calendar invitation with the updated occurrence, I am going to post that link in the chat right now. And if you have any questions, feel free to reach out to me, and I will be sending up a follow-up email hopefully shortly, by the end of the week. Thanks.
Thanks,
Thanks so
everyone.
much, Jordan.